Those of you who don't know me, my name is Bill Lewitt. I'm a paramedic and a nurse. I've worked in emergency medicine for the last 15 or 16 years, give or take, since I was young and thin and still had my dignity. I was an early adopter on hemostatic agents of all different kinds, starting way back as early as 1998. I attended the University of Texas Health Science Center, San Antonio paramedic program. We had a contract with the Army where we would run the 18 Delta SF medics and some SEAL corpsmen and some pararescue guys through a compressed National Registry paramedic program. And while I was there, one of the SF operators that I knew mentioned this thing to me. He was talking about this stuff that looked like kitty litter. And he had taken a physician-level course called Advanced Trauma Life Support at Bethesda. And he said that they have this pig, and they have the pig tied down at the table, and they cut the femoral artery, and blood's squirting out everywhere, and then you just dump this stuff in there, and the bleeding just stops. I was like, all right, dude, that's cool. So, sure enough, a couple years goes by, Quickclot comes out on the market. Everybody knows about Quickclot. What happens when you put Quickclot on somebody? Other than the bleeding stops.
They burn.
First generation Quickclot created a really, really powerful exothermic reaction. That's been resolved. Do we still fly in biplanes? No. First generation products always come and go. Not a big deal. So since we've had the battle lab running for the last 10 or 12 years overseas, we've had all kinds of research on trauma management. This happens in every major conflict in human history. Medical care is put in forward areas for the warfighters. Conflict lasts for as long as it lasts. Those physicians that provide frontline medical care come back and they apply the lessons that they learned to their civilian practice. This is where plastic surgery came from. This is where most of the practice of trauma management came from, all the way throughout history. So, after the Battle of the Black Sea in Mogadishu, the military put out an RFP for some kind of a product that would stop arterial bleeding. Everybody has seen the scene of the young soldier who died from a non-compressible axillary or groin injury. Those are the two biggies. The military wanted a product that would handle that. The first product that fit the bill was Quickclot, and it's been off to the races ever since. Hemostatics are probably one of the most rapidly changing areas of medical care and of the kind of tactical practice that we all engage in here. And it's one of the things that I really kind of enjoy keeping up on and putting out there for the guys in the field who are actually interested. So what we're going to do tonight is something that's a little bit unique, and for those of you who came to the summit last year, or for those of you who have taken any of my other classes, I really kind of pride myself on not only providing state-of-the-art care that's exactly the same as what you would get if you were a physician going to Advanced Trauma Life Support, that exact same level of education, and also in very physiologically appropriate settings. I don't like just getting out there and whipping out the PowerPoint and talking about stuff. You have to actually do it. Nobody comes to the range to talk about shooting. People come to the range to put rounds down range. And so that's what we're going to talk about today. Any questions about anything so far? I talk really fast, I'm sorry. So this is what we're going to do. I have two large pieces of pork tissue here, and we've inflicted several gunshot wounds on it with pistols as well as with assault rifles. So what I'm going to do, I'm going to run through all of the different versions of what's commercially available right now for hemostatics. I'm going to show you guys how they actually work. And then to make it even harder, what I'm going to do is I'm going to take heparin, which is a clinical grade blood thinner, and we're going to thin the blood that's in the bags, and we're actually going to do it again. So one of the claims to fame of some of the hemostatics is that they work in what are called coagulopathic environments. Does anybody know what a coagulopathic environment is? There's two that are very important. Altitude and cold. We have a little bit of both of those around here. When you're at altitude or when you're very cold, your blood doesn't like to clot. Make sense? So in Afghanistan, the elevation for Kabul, I believe, is somewhere around 4,600 feet. Kabul actually isn't really that high compared to the surrounding environment. Plenty of the other areas in that area of operation are actually much higher. I was teaching out in Salt Lake City last year. Salt Lake City, very, very high elevation. You go into the mountains around the area, even higher. Same thing around here. We have cold for quite a few months out of the year. And then if you're up hiking around on the mountains, you're trying to hunt, you do elk hunting in Colorado, whatever, you have plenty of both of those environments. You have cold and you have elevation. The second thing is I look around the room and I see that the average age is about 21. That's great. You gotta laugh at the jokes, man, or it's gonna be a long night. So one of the other things that tends to happen is we start to get a little bit more experienced in life is we start going to the doctor more often, right? What's the doctor like to do? Doctor likes to write you prescriptions because that's how they get paid. So, not by a show of hands, but how many people in the room either are or know somebody who takes an 81 milligram aspirin every day, who takes Coumadin on a daily basis? So, aspirin, we don't think about aspirin very much because it's been around for 100 and something years. You buy it at the drugstore, it costs 87 cents, you get a big bottle of it. Aspirin is a profoundly potent blood thinner. So it does what's called platelet aggregation, which basically it stops the platelets from wanting to bind together to form clots, right? And that's good when we're trying not to have heart attacks. It's really bad when you have a large hole in you. People tend to bleed out. It's also really bad in car accidents. It's bad when you fall and you whack your head because your body's natural defense mechanisms to stop you from bleeding don't work that well. Celox specifically is 510K FDA cleared to work on anticoagulated blood. So we're going to test that out today. We're going to see if it lives up to the hype. So we're going to go through one set and then the other. This isn't a table thing. We're all going to have to get up and actually get a little bit close because I want you guys to actually really see this because I have no investment in these products whatsoever. HemCon doesn't pay me. Celox doesn't pay me. None of these guys. I have the dubious distinction, I guess, of being the guy that teaches the class that you only use when all of the other classes that you're going to take this weekend don't go real well. Nobody really wants to talk about.
Sorry, Bill.
I'm sorry, buddy. I'm the guy with the bad news.
And you're wishing for rain too, aren't you?
I was actually hoping for sleet all day tomorrow. Because the only thing worse than being wet is being cold and wet. So, unfortunately, I have the dubious distinction of being the guy that tells you what happens after the gunfight. Everybody wants to be the tactical ninja, and it's going to be a one-shot fight, and I hope to God that if you guys ever actually have to pull the trigger, that there's no first aid that's going to need to be rendered for you, for a family member, for a bystander that you're trying to defend, whatever the situation happens to be. But the fact of the matter is that bad guys get lucky too, and bad guys also train. Now, taking this out of a tactical context, I've treated a lot more people in car accidents than I've treated for gunshot wounds. So the great thing that I have, the great skill that I have to offer is that you can use this in any aspect of your life at any time. It's not just a tactical skill set. You know, the gun may sit in your holster, you know, just spending money at the range, you know, one 46 caliber round at a time. You make 46s?
No.
That's why people carry 45s. So, you know, just spending that dollar at a time every time you pull the trigger. But you know, every time that we're at the range and we want to feel like we're responsible for taking care of the people that are around us. If there's a negligent discharge on the range, somebody has a heart attack. How many people here are CPR certified? Fantastic. That's great. That's only about a third of the room, but maybe Mike can work on that for us sometime. So, president of the club? Yeah. So, according to the NSSF, what were the number 1 and number 2 injuries on ranges in America last year?
Slip and falls.
Yes, sir, you are correct. Slip and falls and what was number 2?
Heart attacks.
Heart attacks. Absolutely, absolutely. So as the age of the shooters that we're enjoying our hobbies and practicing our skill sets with starts to go up, the chances of you being on the range with somebody who's a little bit more experienced at life and having them throw a clot and developing chest pain and maybe having an MI, you know, it's actually probably a little bit higher than even the possibility of a negligent discharge. So the skill set that we're going to talk about tonight, and the skill set that I help teach and promote through organizations like Goal, through organizations like Any Shooters, are life-saving skills. We all like to think that the skills that we practice are life-saving skills. This is especially a life-saving skill. So, any questions about any of that? Outstanding. So, when it's convenient, what's the best way to do this? I'll tell you what. Why don't we take like a 2-minute break just for, what I'd like to do is have this first row of tables, everybody jump up and everybody help. We're gonna move that row of tables back and then everybody can just make a horseshoe around. Because it's really important that you guys see this.